So let's take a look real quick. I mentioned earlier that there are guidelines in place, and these are the medical guidelines that determine and dictate who should be sent for a coronary calcium score test. The first one is from the American College of Cardiology and American Heart Association. Their gold stamp of approval endorsement of this test for intermediate risk patients. And their statement is quite simply that coronary calcium scoring is the most useful test to improve risk prediction for intermediate risk patients. It's also tied to outcomes like heart attacks and death over time, and it adds predictive clinical value for your doctors once having this test. So again, that's the gold standard, the endorsement from the American Heart Association and American College of Cardiology saying if you're intermediate risk, you should have this test. The second scientific pillar I want to talk about very briefly is the Society for Heart Attack Prevention and Eradication. This is the SHAPE Society. We actually wrote the guidelines for calcium scoring and the detection of early heart disease and published these, and they're now the guidelines across America and around the world. And quite simply, the patient population that should have the test is males without known heart disease, 45 and older, females without known heart disease, 55 and older, or younger adults that have 2 or more risk factors for heart disease, placing them again at intermediate risk. These are the patients that should be calling their hospital or calling their doctor and signing up to have this test.